Good morning. I am really honored to have been selected to give this keynote address, and for a number of reasons that I won't go into, it's somewhat daunting. But it is also particularly meaningful because I get to honor a special friend, Harvey Fineberg, at the last annual meeting of his tenure. When he steps down in June, he will be the longest-serving IOM president in history. That's the history of the Earth, the galaxy, history, period. And it's wonderful to be here and hear all these fantastic things about Harvey and what he's been able to accomplish. Harvey has been a friend for 50 years, beginning in 1963. You heard his introduction about the Kreutzer Sonata. Well, starting in 1963, we met because we both played the trumpet in the marching band. It was the beginning of a wonderful romance. Then we were roommates in medical school. We were Harvey, you haven't changed. We were roommates in medical school, at the Kennedy School, as interns, and as residents. My current wife, Jill, refers to Harvey as Mark's first wife. We studied together, we played, and we decorated our apartments together. And we dreamt how we could make this world a better place. And Harvey, you did that. Harvey finished a PhD in public policy, and with support from the dean, Howard Hyatt, the most extraordinary mentor I have ever met. Harvey became a professor at the Harvard School of Public Health, then chairman of the Department of Health Policy and Management, and then dean of the school. Then, like Washington, he crossed the Charles River to become the provost of Harvard University. Harvey was at Harvard so long that I was afraid he'd never be able to leave. I thought that his middle initial, V, had now come to stand for the Harvard motto, Veritas, or truth. Fortunately, the IOM came along and recognized his extraordinary talents. I was told that Harvey is universally acknowledged by the IOM staff as the master of keen insight in anticipating problems, seeing logical inconsistencies and gaps in evidence. And under Harvey's leadership, the IOM has improved. With the wonderful staff, the IOM has made extraordinary progress on many fronts in the last 10 years, and Harvey led the IOM through the largest expansion of activities, funding, and staff in IOM's history. And Harvey himself told me, he said, "This is the best job I could ever have had. I get paid for speaking the truth." Veritas. Now there's the Harvey V. Fineberg Impact Fund. How perfect is that V? Right there, how perfect is that? Veritas. One of the areas where the IOM has made a substantial contribution, where science has progressed and the truth is coming out, thanks to the work of many dedicated advocates and scientists, often working together, is in this area of violence prevention. The Forum on Global Violence Prevention grew out of the inspired vision of Fran Henry, who saw that violence was a global problem and needed an organizing and sustaining platform that could convene individuals and organizations working on the problem to help sustain and develop their efforts. And it came together under the remarkable leadership of Patrick Kelly, Jackie Campbell, and their team. And many of the members of that forum are here today, and several of them will be on the panels that you will hear. And thanks to the members and the staff of this forum, it's become a force that is moving this field forward and bringing it together. In talking about violence prevention, I want to make three central points. The first is that the prevention of violence must be based on science. Science is every bit as important here as it is in the development of pharmaceuticals and new medical devices, and it will be every bit as effective as it has been in the fight against heart disease, cancer, and road traffic injuries. We have every reason to be optimistic about the ability of scientific research to deliver us to safety. Second, but keeping science in the forefront won't be a slam dunk because there are challenges, including political forces and strongly held cultural and social beliefs that may stand in our way. We need to keep politics from stopping or interfering with our research. I'm not that naive to fail to recognize that public health is inherently political, and the issue of firearm injuries is more contentious and therefore subject to more political intrusions than many public health fields. But we can't afford to let scientific research be contaminated, manipulated, or stopped by organizations or individuals driven by their own economic gain or their own personal agendas. We need to be wary of arguments driven by ideology rather than by evidence. And the third point, the field of violence prevention must be collaborative to succeed. Collaboration in the service of violence prevention is not just something nice or polite or politically correct. It's not just a good thing to do, but it's a matter for so many of life and death. Let me start by sharing with you a very personal story about someone who taught me a tremendous amount, someone who was steadfast in her pursuit of the truth. I first met Vi Harwell when she was in the intensive care unit, and she was not talking or interacting with her caretakers or the people around her. I had trained as a psychiatrist, so her doctors thought I would be able to get her to communicate. I introduced myself, and I sat with her and sat and sat and sat, and then came back and sat some more, and finally she started to open up. Vi Harwell grew up in a family and in a place where violence was common. When she was a child, her brother Bobby had intervened in an argument that a young and intoxicated man was having with a woman. He stepped forward to protect the woman. The young man thought that Vi's brother had embarrassed him and disrespected him, and several days later, he sought revenge by shooting and killing Vi's brother. Vi went on to marry Alex. Alex was the first black state trooper in Tennessee, and Vi herself became the first black woman selected to the school board in Pulaski, Tennessee. She even had her own radio show and received the Outstanding Young Woman of America award. They had an 8-year-old son, a boy, little Alex. But her husband felt that Vi was neglecting her, that she was too busy with her work. She was becoming better known than he was, and for him this was unacceptable because it wasn't consistent with the image he thought the man of the household should have. The tension grew between them, and finally Alex was asked to move out of the house. He started to drink more and threaten her more, and the tension grew and grew. Things got so bad that Vi finally asked her husband to move out of the house. Her husband was furious, and he drank even more, and he waited one night for Vi's girlfriend to leave their house, and then went up behind Vi, put his .357 Magnum to the base of her skull, and fired the gun at point-blank range. Vi survived, but she was totally paralyzed from the neck down, dependent on a ventilator. She could swallow and she could speak, but only if she timed it with the exhalation of the ventilator. That's when I met Vi at the Shepherd Center in Atlanta. And over a period of 4 years, we got to know each other very well. speaking by phone at least every week. She was one of the most amazing people I have ever met. But Vi lived in fear that one day her ventilator might become disconnected and she would be powerless to do anything about it. And one night in March 1994, that happened. Vi had started going out with her husband in about 1963. Next slide. And if only we knew then, and had applied what we know now about violence prevention, things might have been very different. In Vi's community, young black men were killing other young black men so frequently that there was a sense that violence was inevitable, senseless, and not preventable. Young black men like Vi's brother Bobby were dying in large numbers. When we compiled the homicide rates for the U.S. and compared them to rates for other comparably developed countries, the U.S. stood out. When we compared the rates for young black men in the U.S. with the rates from other countries, we saw that the rates went on and on. David Satcher has taught all of us the importance of addressing health disparities, but this is a health disparity on steroids. If you look at the top slide here, go back one, what you see is the rate for the U.S. compared to 24 other comparably developed countries. These are the rates for young men, 15-24, dying of homicide. And you can see that the rates for the U.S. far exceed even the next highest rate in Scotland. But when we put on this graph the rates for young black men, next slide, the top line shows the rates for the U.S. overall. The next line is for young white men in the U.S., which you see even exceed those of Scotland or any other country. And then the third line is the line to watch. That's the rate for young black men in this country. And you can see at the bottom of this slide, it goes up beyond 10, 15, 20 to 25. And as you see in the next slide, the rates go on and on and on and on. This is a disparity to end disparities. These were the rates that made people feel we couldn't do anything about it. But we have learned that violence is preventable. Criminal justice, in large part, had focused on intervention after the fact, using both specific deterrence and incarceration. But public health said, let's go upstream to see who's throwing them into the river. Let's focus on prevention. We've developed a scientific framework that helps us understand homicides, that helps us understand domestic violence, and it's based on science. It asks 4 basic questions. What's the problem? What are the causes? What works? And how do you do it? How do you have impact? How do you implement it? How do you deliver the programs? The same questions can be asked about what happened to Vi, intimate partner violence, gender violence. What's the problem? What are the causes? What works? And how do you do it? The impact of Vi's shooting on Vi's son, little Alex, was great and very long-lasting. He used to wake up with nightmares and went to therapy. He got better for a while, but had a very hard time focusing his life and completing school. Lenita, Vi's sister, told me that Alex had some bad dreams and woke and came to my bedroom. He had a nightmare saying that his dad was chasing him with a butcher knife. We calmed him down and assured him that he loved him. We told him that his mom loved him too, and that he didn't ever have to worry about his dad chasing him with a butcher knife because his dad loves him. Lenita said, I just let him get into bed with us, and he went to sleep. But she went on to say, little Alex had been a wonderful student before he moved here to Chicago with us, but during the winter he started having a lot of problems. His teachers let us know that he wasn't doing his schoolwork or turning in his homework, and worse than that, he was lying about it. When we found out, I started going with him to a child therapist, and that worked great. It really turned him around, and he went from being a real problem to where he was selected as a star student of the week. And they invited me to come to his class on the day he was supposed to get the award. It was a surprise. I was delighted, and he was surprised and very happy. And after he got the award, he introduced me to his class. He said, "This is Lenita, my mother." Better, yes, but healed, no. We used to think that the cost of violence was primarily the sum of the costs of taking care of the acute injuries that resulted from that violence. But we've had to make a huge, huge paradigm shift because of what the science has shown us. The game-changing studies on adverse childhood events by Falidi and Anda and many others demonstrated empirical associations between early exposure to violence and subsequent major causes of mortality in adulthood, such as the non-communicable diseases. Early exposure to violence, neglect, and abuse leads to children who grow up hypervigilant, unable to calm themselves or damp down strong hormone-driven feelings to fight or take flight. And as they grow up and across the lifespan, they are at higher risk for hypertension, heart disease, asthma, substance abuse, high-risk sexual activity and sexually transmitted diseases, suicide, and again, more violence. And now we're starting to understand the biological underpinnings for these associations. Traumatic stress, such as that associated with violence, impairs brain architecture, both structure and function, and can confer lasting damage at the most basic levels of the nervous, endocrine, and immune systems. These exposures can even influence genetic alteration of DNA. And importantly, research summarizing the epigenetic effects of early childhood experiences suggests that the same multifaceted gene-environment interactions that may cause negative health consequences after exposure to chronic stress also appear to confer positive health consequences after exposure to early environments that are engaging and nurturing. Epidemiologic research complements these findings, demonstrating that early nurturing in the home leads to sustained positive economic and psychosocial consequences up to 5 decades later. Nurture affects nature. Violence extends across the whole lifespan, from child abuse and neglect to elder abuse, including suicide and self-directed violence. And each type of violence can be understood with the same scientific approach, asking the same 4 questions. If the 4 questions weren't already patented and copyrighted, we could call these the 4 questions. They help us that much. The second big point I want to make is that we need to keep politics out of our research and make sure that our science is driven by evidence and not ideology. Because politics interfered with research at CDC, we don't understand what we need to know about how to prevent firearm injuries. Another result is that those we're trying to serve are paying the price, with lives lost, families shattered, and children and communities terrorized. In 1963, the same year that Vi's son Alex was born, my family and I moved down from Boston to Atlanta, and I joined the Centers for Disease Control to help start a program looking at violence as a public health problem. We started to put together a science base for the prevention of firearm injuries. In the 1990s, the National Rifle Association and the forces of politics killed that program. Since the Newtown massacre, the national statistics on gun violence have been widely reported. Firearm deaths number more than 30,000 each year, and 2/3 of these deaths are suicides. Tens of thousands more people are seriously injured by guns, and those injuries impose significant and frequently lifelong burdens for care and rehabilitation on families, communities, and the healthcare system. But we've known little about these deaths other than how many occur each year. We faced a similar challenge 50 years ago when we realized that cars were killing too many of our citizens on the highway. In the mid-1960s, the federal government invested hundreds of millions of dollars in research that helped us reduce the risks related to motor vehicle crashes. We discovered ways to make cars safer by adding front and side impact protection, seat belts, airbags, anti-lock brakes, and elevated rear stoplights. We learned how to improve roadway design to make roads safer, and we understood how to make drivers safer by passing stricter laws that could get the majority of drunk and impaired drivers off the road. As a result of this research, as the benefit of that science, the impact it had, we've saved more than 325,000 lives between 1960 and 2002. At the National Center for Injury Prevention, we set out to do similar research on firearm injuries, a problem that accounted for about the same number of deaths as motor vehicle crashes. We wanted to answer the same 4 questions that we used to understand other specific forms of violence. What's the problem? We wanted to know how many firearm-related injuries occur, where, when, and how they occur, the characteristics of the shooters, and the relationship between the victims and the shooters, and the circumstances of death and the weapons used. Next question, we asked, what are the causes? What are the factors that increase or reduce risk? We found, for example, that the presence of a firearm in the home, rather than being protective, was associated with a 300% increased risk of homicide and a 500% greater risk of suicide. The third question, what works? What practices or policies prevent firearm deaths and injuries? Some simple interventions have proven effective, like child-proof locks, storing firearms locked and unloaded, but we've not yet, as you see in this slide, we've not yet adequately studied the impact of most public policies, such as gun owner licensing, firearm registration, background checks or criminal histories, or mental illness, or barring access to certain types of weapons or ammunition. We don't know, for example, how death and injury rates are affected by prohibiting gun ownership by felons or by adjudicated seriously mentally ill. We just don't have the evidence. The fourth question, how do you do it? How do you implement effective practices and take them to scale? This is similar to the challenge of disseminating best practices in medicine. We'd like to generate and deliver evidence-based practices that could be widely adopted. We can show where we're strong and where we're weak if we take the public health approach with its 4 questions and put a vertical scale on the left that shows the 4 phases of knowledge as identified by John Seely Brown. The 4 phases start with knowledge generation or research, then knowledge integration, putting the newest findings together with what was previously known in different fields. Next slide. Then dissemination of your findings. And finally, knowledge application, putting knowledge to use. The next slide. In the area of what works to prevent firearm injuries, we know a fair amount about the first 2 steps, but woefully little about what works and how do you implement and scale up the things that work. So at CDC, we set out to answer these questions by collecting surveillance data on firearm injuries and supporting investigator-initiated peer-reviewed research. Had we done so then, we might have saved many of the more than 500,000 lives lost to firearm injuries in the last 17 years. But the NRA leadership stopped us by misrepresenting our research. They told their members that our research would result in all firearms being confiscated, and the pro-gun constituents launched relentless attacks on our science, calling the Injury Center the cesspool of junk science, and comparing me to someone with the same last name who was Hitler's chief political strategist. A local conservative talk show host told his audience that I needed to be stopped and done away with. 6 senators wrote to the secretary of HHS requesting that I should be fired and the Injury Center shut down. In 1966, they persuaded a number of congressmen and senators to eliminate firearm injury research at CDC. Led by Congressman Jay Dickey, a Republican from Arkansas, the House removed $2.6 million from the CDC budget, an amount designated to support a firearm injury surveillance system. Although the Senate restored the money to the budget for other purposes, Congress added language to CDC's appropriation bill that said no funds could be used to advocate or promote gun control. Now, we were in the business of scientific research, not advocacy, but this ambiguous language was a threatening shot across the bow that effectively undermined firearms research. Federal bureaucrats grew wary of conducting research about which the NRA could harass them mercilessly. David Satcher, then director of CDC, asked for a review of CDC's firearm research portfolio by a panel of highly respected scientists. This review concluded that the research was extremely well done, important, and that there should be more of it. Dr. Satcher protected the research, and he protected the researchers. But it wasn't only the NRA and their allies that undermined our effort. Even scientists we had funded turned against us. I don't think it would come as a surprise to hear that scientific research is an intensely competitive enterprise, nor should it come as a surprise that a research area that has many committed scientists competing for very limited resources tends to have its share of disappointed and disgruntled scientists and opportunistic administrators who are not only willing to sacrifice a field like gun violence research, but will actively participate in the attack when it suits their own personal self-interest. They turned on scientists who were and still are seeking truth-based in science. We desperately need more leaders like David Satcher, who not only allow scientists to pursue questions when the questions and answers they generate may not be politically popular, but they will actively defend them when they come under attack. The money that CDC spent on firearm injury research fell drastically by more than 95%, and at CDC today there remains a small group of extraordinarily dedicated and able researchers. But guns is a four-letter word, a word that makes researchers cringe because it's a red flag that makes it very difficult to get a paper cleared or research approved. The harm that was done 20 years ago when the NRA fought to eliminate research funds was lived out in those months following the massacre at Newtown because there was no science on which to base policy solutions. So President Obama ordered CDC to get back to work on firearm injury research. Some studies will need government or coalition funding because they will necessarily involve many subjects in large jurisdictions with data collected by multiple agencies for long periods of time. In addition, like the solutions to motor vehicle injuries, no one approach will address the whole problem. Solutions will be multiple and incremental. Assuring that science is driven by evidence and not ideology, and not diminished by politics, is no simple task. Public health is a political field, and the last step of the public health approach, implementation or delivery, requires political will. This is true of not just highly controversial and headline-grabbing issues, but it applies to all of public health. So while we must be politically savvy, we must be relentless in our effort to do what Bill Foege lists as one of the most important lessons he has ever learned: know the truth. Veritas. We still face challenges in bringing the benefits of violence prevention to low and middle income countries where men, women, and children bear 90% of the global burden of violence. And the principal obstacle here is that we lack proof of effectiveness for many interventions in low and middle income countries. And without the proof of effectiveness, neither country governments nor donors want to invest in preventive interventions. And without their wanting to invest, we can't demonstrate effectiveness, a vicious cycle. In addition, most low and middle income countries don't have the capacity to collect the types of data we need to measure the cost effectiveness and rigorously evaluate the outcomes. Still, there's some extremely exciting work going on in the area of violence prevention in low and middle income countries, working with UNICEF and PEPFAR in a multi-sectoral coalition called Together for Girls. Jim Mercy and his colleagues from CDC have been conducting a series of surveys looking at the impact of exposure to violence, abuse, and neglect on children in a number of lower middle income countries. These surveys have demonstrated that children in lower and middle income countries in Africa, Asia, and the Caribbean experience violence at horrifying levels. One-third of girls experience sexual violence as a child, and half to three-quarters of both boys and girls experience physical violence. Based on these and other surveys, it's estimated that 1 billion children, or half the world's children, are exposed to violence each year. We've also learned that these children very rarely receive services for their exposure to violence, and they suffer a variety of health consequences, including an increased risk of suicidal behavior, mental illness, unwanted pregnancy, and a greater likelihood of engaging in HIV risk behaviors. But most importantly, these surveys demonstrate that data, information, knowledge, understanding, and ultimately the truth can drive action. The countries that have conducted these surveys have used the data to initiate a variety of policies and programs to respond to and prevent violence against children. My third and last major point is that if we are going to be successful going forward, we will have to do a better job of respecting, understanding, and working with each other. In the area of firearm injuries, collaboration has a very special meaning. Our research must simultaneously meet two objectives. The first is to reduce firearm injuries. The second is to be mindful of the legitimate concerns of responsible, law-abiding gun owners. This task is similar to finding a chemotherapy for cancer that will both stop tumor growth and preserve the patient's overall well-being. There are plenty of drugs that will stop tumors dead in their tracks and shrink them away. But if this were our only concern, we wouldn't need research to find new drugs. The problem is that these drugs are toxic. And while stopping the tumor, they also severely damage the kidneys, liver, and heart. If we were not concerned with a tumor's growth and concerned only with protecting the patient's kidneys, liver, or heart, we might not need research to find new and better treatments. But when we want to stop both the cancer and preserve the patient's vital organs, the challenge is both different and much greater, and we need good scientific research to find the solutions. So it is with firearm injuries and protecting gun rights. Ignoring either objective might make research unnecessary. We could disregard the risks of death and injury, and as the NRA suggests, do nothing to limit access to firearms, the types, number, or way they are sold. Or we could set aside gun rights and prohibit civilian ownership of firearms. Either of those paths make easy work for the policymakers. But the Constitution of this country and our duty to protect the lives of family and community members require us to pursue both objectives and make informed choices. We need research to find out what works to reach both objectives, to find the best way forward. And as with new medical treatments, we also need to be wary of arguments driven by ideology rather than evidence. And if we want to benefit from the potential of science, we'll need to move away from the culture of suspicion and confrontation that has characterized this area for almost 20 years. We can no longer stand back and let the NRA frame the discussion and polarize the field. They set out to make zero tolerance the platform on which they would present their arguments, defend their sales, stand their ground, and eliminate those who don't want to play by their rules. Nor can we let the discussion be polarized by those who see the solution for reducing firearm injuries and deaths in the banning of all guns from civilian hands. In conclusion, the next slide, Vi Harwell lived the last 4 years of her life as a quadriplegic and ultimately lost her life because of a firearm injury. That was almost 20 years ago. And between then and now, more than 600,000 people in this country have lost their lives to firearm injuries. This does not have to continue. Science has dismantled the superstitions of ignorance one after the other. And during our own lifetimes, we have seen extraordinary progress made in protecting us from cancer, heart disease, mental illness, and death on the highways. So too, science will dismantle people's belief that violence is an inevitable part of being a human being. Second, we can't let the science in a vital life and death area like this one get sidetracked or derailed. Harvey says that he has the best job in the world because he gets paid for telling the truth. Over the next 25 years, we'll have an extraordinary opportunity to move this field forward by discovering the truth and telling the truth. But while it is just what we need for staying alive, it won't be easy. When Vi's husband went on trial for shooting Vi, the jury was not allowed to hear the truth. They were not allowed to hear about domestic violence. The concept couldn't be introduced. Truth was remarkable there for its absence. Vi's husband testified that he had his .357 Magnum out for target practice, even though it was late at night and pitch black outside. And he said that the gun went off accidentally while he was standing in front of Vi. The medical examiner testified that Vi was shot at point-blank range from behind her, and that a .357 Magnum required too much pressure on the trigger to go off accidentally. In a gross miscarriage of justice, her husband was totally acquitted. We can't allow a gross miscarriage of science. There is too much riding on this. And finally, we need real collaboration. J. Dickey, my archenemy when David Satcher and I testified before the House Appropriations Committee in 1966, was so angry that my CDC handlers had told me, "Don't you dare ever speak to that man." They said it would be like throwing a match on gasoline. I guess they had great faith in my abilities to collaborate. But one day, a staffer called me into his office and said he wanted to go over some things and understand the data better. So I did go to see him, and we spoke. And as I was leaving, he said, "Oh, by the way, the congressman is here and would like to see you." What was I to do? I didn't want to be fired, but I didn't want to be completely impolite, so I went in. Now, Jay is a born-again Christian, a Southern conservative Republican working for the NRA, and I was, as you saw in a picture, a young Jewish long-haired liberal from the Northeast. But over time, we became good friends, and we came to know and trust each other. That trust is critical, and we've come to agree that we must do more research to learn how to prevent firearm violence. Writing about the situation in Egypt, and I show you an RFP that just came out, and this is a call for proposals to prevent violence, and it has the language in here in red that the fundamental goal of this funding is to produce within the next 3 years applied research that can be used to advance the development and/or implementation of gun violence prevention policy, and that is mindful of the legitimate concerns of responsible, law-abiding gun owners. I see this as a huge step forward that comes from collaboration. Writing about the situation in Egypt in the New Yorker earlier this year, George Parker said something that could equally well apply to the stalemate between the sides that oppose each other on the gun issue and the violence in the Middle East. He said, "The core political problem is a culture of suspicion and confrontation, a mentality of winner take all. We have two groups that regard one another as obstacles to power, not as legitimate players in a complex game that requires inclusion and consensus." I have learned so much about this from Jay Dickey, who over the years has become this close and trusted friend. We now agree on the importance of inclusion and consensus and the critical role that trust must play in getting us there. The prize for all this? Safety. Safety for our children, our families, our communities, and our country, and beyond. It's too big a prize for us to lose. In the short, medium, and long run, the cost of proceeding with our eyes closed to the truth will be much more than we as a civilized and caring society can afford. Thank you very much. I do want to acknowledge the people who have helped me learn about this field all along the way, the people who have supported me. And like Diana Nyad's swim, this has been a team effort and a team presentation this morning. So many people have gone before me, have done such important work and contributed in so many important ways to help transform the field, and you'll hear from some of them later this morning. In particular, though, for this presentation, I want to thank Don Berwick, Alex Bouchard, Jay Dickey, Bill Fagey, Fran Henry, Howard Hyatt, Jim Mercy, and my current wife, Jill Rosenberg. Thank you so much.
Well, as you can tell, I owe a lot to Mark. Especially, I'm grateful for him not showing any pictures of the bell-bottom turquoise sleeveless suit.
It was a hard choice, but friends said, don't embarrass him at this time.
Yes, it was a condition of his service. But this was a very powerful and a very important lesson for all of us, Mark, that you delivered. Thank you. Thank you so much. We're going to now be able to take a break. We're going to reassemble promptly at 10:30. As you leave the auditorium, you'll be able to pick up the press release that announces the newly elected Institute of Medicine class of 2013. In addition, you can find a copy of the supplement to the President's Annual Report, a brochure that describes our award winners this year, a copy of the Informing the Future that covers the last 2 years of work at the Institute of Medicine, and a brochure on the President's Impact Fund. Thank you all, and thank you again, Mark Rosenberg.